Good afternoon. It's a warm, sunny day. Happy Wednesday. So I want to thank everybody for tuning in to our regular Wednesday press conference. We'll be here every Wednesday at 1 o'clock. I hope these sessions are helpful for you. It's still so important to stay informed. Information is coming at us every day from all kinds of different sources. And from the beginning, we've said facts, not frenzy. So please tune in, get your data here. And it will help you and your family stay safe and stay informed as we continue to battle the COVID-19. If you're not able to tune in and you'd like more frequent updates, I would encourage you to go to the governor's website and sign up for daily email updates. You can do that at governor.ri.gov. You'll get an email update every day. Okay, so we'll begin today, as we always do, with the data, and I'd ask you please to put the data screen up on the screen. You'll notice it looks different today, and I'm going to take a few minutes to explain that. Yesterday, we performed over 8,200 tests, and we saw 121 new cases. That gives us a percent positive of about 1.5%. So that's a good place to be. 1.5% is among the lowest in America. It's far below the 5% threshold, and so it's a good place to be. We've now done over 700,000 tests, which is amazing to me that we've done that. That's the equivalent of roughly 70% of our population. It's among the highest in America. To me, it feels like yesterday that we were trying to do a few hundred tests a day. Now we're doing over 8,000 a day. Thank you to the National Guard and the team for making that possible. I'm very sad to say that yesterday we did have another 3 deaths, bringing our total deaths from the virus to above 1,100. And of course, I'm sure you saw yesterday, America suffered its 200,000th death. So we continue to lose people every single day to COVID-19. It's a reminder to all of us to not let our guard down, be vigilant. The virus takes people every day. We can live with it safely. We have to, though, follow the rules. Now, as I said earlier, you'll notice the dashboard on your screen looks a little bit different today. From day one of this crisis, I have promised to you that we would be transparent, we would share the data on a daily basis, and we would do everything we could to put just the facts and the data in front of you. And I'd like to think that we've done that. The COVID tracking project, which is a national COVID tracking project, gives Rhode Island an A+ for our data quality. That said, we're always looking to be better and provide it to you in a more relevant way and more data so you can use it in your lives. So we're now into the 7th month of fighting the coronavirus. And I felt that it was appropriate, 7 months into it, to continue to provide you with the same data that we always have. And you'll see that on the left-hand side of your screen, it's the data you're used to seeing: daily cases, daily deaths, daily hospitalizations. But I also think it's important for us to start reporting on trends now that we have been into this for a while. So again, this is all about where we've been, where we are today, and where we would like to go. And I think it's important for you. We track the trends. Where are we this week versus last week? Where would we like to be next week? And I think it's important for the people of Rhode Island to be able to see that as well. I should let you know that we don't do this lightly. We've consulted with local and national health experts at Brown University, Johns Hopkins, Hasbro Children's Hospital, Rhode Island Hospital, the CDC, and others to advise us on the most important metrics to track, and this is what we have come up with. So you will see on the left-hand side, it's the same data you're used to, and then in the body, you'll see 3 different graphs. At the top is the average percent positive rate. In the middle is new hospitalizations. and the bottom is new cases per 100,000 people, population. So these are rates that we want to continue to follow. I will point out, Rhode Island is testing more than almost any state in the country. So it's important that we look at the rate, not just the number of cases, which is why we really want you to continue to focus on percent positive versus just the raw number of cases, because obviously if you test more, you will find more cases. And not only are we testing more, we're testing in high density communities where there are likely to be cases. We're fishing where the fish are. So if you see the numbers going up a bit, you shouldn't be alarmed, because it could partially be explained by the fact that we're testing so much more. So that's why I want you to be able to see the trend in percent positive, which accounts for the number of tests that we're running. Every Tuesday, these graphs in front of you will be updated to display the previous week's data. You'll also notice a red line on each of those three graphs. The red line represents the threshold above which we need to consider imposing new restrictions. Now, to be clear, it doesn't mean that we will wait until we get to the red line before imposing restrictions. As we've done all along, we're going to take a targeted, data-driven approach based on the overall trends that we're seeing. And if I feel we need to tighten restrictions in one particular area or one particular business, as we've done with bars, then we're going to do that. But the red lines do give us a sense of when we might need to consider wholesale, statewide, across the board restrictions once again, including the possibility of moving back a phase. You'll also notice that the red lines correspond to thresholds that we have been talking about for a long time. That these thresholds in each red line correspond to a metric that we've already been using in our reopening plan. So in the top graph, the percent positive, the red line is drawn at 5%. To remind you, 5% is the metric we use for our quarantine requirement from other states. That's when we impose the travel restriction if folks are coming from a state with greater than 5% positive. In the middle graph, the new hospitalizations, the red line is drawn at 210 new hospitalizations each week, or 30 new hospitalizations per day, which is consistent with our metric for moving between phases. And finally, in the bottom graph, new weekly cases per 100,000, the red line is at 100 cases, which you will recall is our metric for a full reopening of schools. So the reason that we didn't clear Providence and Central Falls for a full reopening of schools is because they were above 100 cases per 100,000 people in a given week. I would also like to point out, as you're seeing this, you should have a sense of confidence that in every instance, we're quite a bit below the red line. And by the way, we never want to get to the red line. So for me, this is helpful, and I hope it's a snapshot that helps you. It tells us exactly where we are, how close we are to the red line, and what our trends look like. In the right column, you'll see the blue arrows. The blue arrows compare each of those three data points to the previous week. So for example, this week, you'll see the metric for percent positive and new cases is trending up. So the arrow's pointing up. The metric for new hospitalization, the arrow's pointing down, which is excellent. It's trending nicely downward. Now, I also want to say this. Just please don't panic if you see an upwards arrow. A percent positive of 1.4%, while it is up from last week's 1.1%, is still an excellent and safe rate and well below the threshold of 5%. And the significant decline in new hospitalizations from 58 to 41 is great news. So in general, I hope this helps you. It is updated every Tuesday, and it just gives you a quick snapshot of where we've been, where we are, and the trend we'd like to continue to go in. I would like to especially call out the new cases from last week. As you'll see, they're up. That is primarily because of the outbreaks that we've seen at Providence College and URI. So as you may know or have seen reported, last week we had a significant number of cases, increased cases at Providence College, and to a lesser extent at University of Rhode Island. Between those two schools alone, PC and URI, we saw approximately 190 new positive cases, 150 new positive cases at PC, and 40 new positive cases at URI. Without those cases, our overall case numbers were stable, actually declining slightly last week. So it's important for you to know that, because if you were to take out PC and URI, we are stable to declining. Obviously, with 200 cases from two schools, that's a problem, and our cases are increased. And I'm going to talk about that further in a minute. With respect to the schools, I've been getting a lot of questions. Governor, what's going on at PC? Why is this happening? How bad is it? What's going on? So permit me for a minute, please, to explain what I think is going on. So at Providence College, as part of the school's regular surveillance testing, we identified a group of cases early last week. Last Monday, we identified a dozen cases out of 400 people tested that day. The next day, we tested another 400 people, and we found 17 positive cases. So we noticed at that time that many of the students who were testing positive were students living off campus, particularly in apartments on Eaton Street. You might be familiar with Eaton Street. Many of these homes are triple deckers, rented to college students, and as college students do, the students were often getting together on their front lawns, in their backyard, on their porches, and this was confirmed by our case investigators, who found that many students were moving between houses, between floors in the house. But here's an important point. There was no big party. It wasn't as if there was one big party that led to this outbreak. People were in small groups, relatively small groups, but their groups were not consistent, and they weren't wearing masks, and they weren't practicing social distancing. The problem is they get together with one small group here, maybe go upstairs to the second floor, another small group, go to the front lawn, another small group, and before you know it, we have a full-fledged outbreak on our hands. This is an opportunity for me to remind you, please, it's not only keeping groups small and social gatherings to 15 or fewer. Please limit your social network. Try to keep it to the same 15 people or the same 20 people. I know people are getting back to work and going to school. I understand that. But try to limit your social groups, because in this instance, there was no big bash, but it was the kids going, 5 people, 15 people, 15 people, and we have a problem. After identifying the initial cluster of cases, the Department of Health, who handled this expertly, made a decision to immediately test all off-campus students, which was about 1,100 additional people. 67 of those tests came back positive, and regular testing of PC students has continued. I do want you to know we are taking action. A stay-at-home order was issued for all students. So all students on and off campus at PC have been directed to stay at home, stay-at-home order. Roughly 120 students have been set up in alternative housing locally to isolate and quarantine safely, and a mandatory testing program was put in place. I would say this is still an active outbreak. We're working it every day. It's an active outbreak. We're not out of the woods yet. We do, though, have a handle on it. Providence College has been cooperating with the Department of Health and is handling it appropriately, aggressively, and I'm grateful for that. But we're not out of the woods. We are not out of the woods. We have to continue testing. And to the students at Providence College, I'm asking you to obey the stay-at-home order because this isn't right, what's happening. And it's not only that hundreds of kids have been infected, it's impacting the entire state. And I'm going to talk about that in a minute. So we're supporting PC. I'm asking the administration of PC to take this very seriously. And to the students at Providence College, please follow the rules. Please follow the rules. And I understand at PC there will be consequences for the students, even if you're living off campus, if you don't follow the rules. At URI, there were 3 Greek houses in which we saw a total of 6 cases last week. Through rigorous testing, we also identified several groupings of cases among other student houses for a total of about 40 cases last week. Similar to the situation at Providence College, we did not trace the cases back to a single big party, but rather to smaller interactions in which people report that they weren't maintaining social distancing, sharing drinks, eating out of the same plates, not wearing masks, not being diligent, and we have an outbreak. Because the URA cases have been more isolated than at Providence College, where we've had a cluster of cases, we have not needed the same campus-wide mitigation measures, such as the stay-at-home order. But we're still responding very aggressively, and the team at URI has been excellent in their the seriousness and aggressiveness with which they have reacted to this, and I want to thank URI for that. Just so you know, if someone tests positive, they're immediately put into isolation housing right away, and their entire group of contacts is immediately tested and quarantined. We are urging these students not to go home. We are urging these students, please don't go home to another state. I know it's hard to be here sick. I know parents would like to come get the students and bring them home, but we're asking, that just spreads the virus, and if every state and every college did that, we'd have nationwide outbreaks. So we are, I guess for the people of Rhode Island who are very concerned about this, we have a good system. We're testing, in the case of PC, everybody. We've set up isolation rooms and quarantining rooms, and our contact tracers are all over this. I'm sharing this for a couple of reasons. One, as I said, I'm getting a lot of questions about it, and I want the people of Rhode Island and maybe parents of students at PC or URI to feel reassured that we're all over this. We're on top of it. We have the situation under control. We've set up extra housing. We're having food delivery to that housing. We're doing contact tracing. We're doing massive testing. We know how to handle this. It's unfortunate that it happened, and I think it was avoidable, but it did, and we will handle it, and we will get it under control. The other reason that I'm sharing this is let it be a reminder to all of us the consequences of letting our guard down and not following the rules. These are college students doing what college students do, which is going back to campus and having parties and hanging out with their friends. And normally, that's okay, except not this year. Behavior like that this year endangers other people's lives, and it's incredibly selfish. So for all of us who are getting sick of wearing our masks and wish we could have a party and wish we could go back to life as normal, we got to hang in there, because the minute we let our guard down, the minute we get lazy or lax, people get sick and bad things happen. To that, and also, as I said earlier, even small gatherings can be a problem. If you hang out with a different 5 or 10 people every night or regularly, it's a problem. That can be a vector for spread. Even it's not just big parties. So I'm just asking you, please, I know it's been 7 months. We're imposing these rules for a reason, and if you follow them, we'll be fine, and if you don't, people will get hurt. To the point of consequences, we're all feeling the consequences of these outbreaks at Providence College, and to a lesser extent at URI, because yesterday Rhode Island was added back to the New York, New Jersey, and Connecticut quarantine travel list, and I'm sorry about that. Unlike many other states, including us, these states rely on case incident rate, not just test positive rate, which makes it more difficult for states like Rhode Island, where we have very high rates of testing. We're showing more cases. By the way, it's a good thing to have high rates of testing. So as I just mentioned, because of the clusters at PC and URI, our cases have gone above the 10 cases per 100,000 per day, which is the test applied by Connecticut and New York. So unfortunately, we're now on the travel restriction list for those two states. As a reminder, our own travel restriction applies to anyone coming to Rhode Island from a state with a percent positive rate above 5%. And I'd ask you to please put the slide up with the states on that list. There are 28 states which have a percent positive above 5%. And if you come to Rhode Island from one of those states, you have to quarantine when you're here or prove with a test that you have tested negative. Also, if you're a Rhode Islander who's gone to one of these states, when you come home, you either need to get a test and prove that you're negative, or you're self-quarantined for 14 days. I will tell you, I have been in touch with the governors of these states, Massachusetts also, trying to prevail upon them to relax their travel restrictions and to take into account the fact that Rhode Island we're testing so many people, in fact, quite a bit more than any of those states, I will say, and Rhode Island is a safe place. I'm asking them to consider using a percent positive instead of number of tests. So far, I have not been successful, but I want you to know I'm trying, I'm on it, I'm sorry for the inconvenience. And to all the people at PC who played a hand in this, these are real consequences. This is hurting people's business in Rhode Island. I have heard from business owners throughout the state whose businesses will be hurt because of this New York, Connecticut, Massachusetts ban. So if you think it's fun to have those parties which lead to an outbreak, and if there's something more the administration could do to have prevented this or to put a lid on it, I'd ask you to do that because it's hurting the whole state. And to everyone else out there on a college campus, in a place of business, wherever, it's not a joke. We're hurting people because of our selfishness, and we know that following the rules matters. It is my hope that through our continued vigilance and our good systems, we'll be able to pretty quickly get off of the New York, Connecticut list, and I'm sorry in the meantime if it's disruptive. Okay, I want to talk about schools. Last week was the first week of school. It was fun for me. I got to see a lot of these young students who've been cooped up for a long time without school, and it was great. It was great. Thank you to everybody who's working so hard to make it so that these kids can go back to school. I'd like to give you a brief update on the K through 12 testing system. Last week, the first week of school, we tested an average of 250 people per day just through the separate K-12 testing system. I want to remind you, so that's 250. That's a lot in 1 week. But as a reminder, we have the capacity in the K-12 testing system that we set up to test 5,000 people a day, just in K through 12. So I hope that gives you a sense of confidence and calm. If you're teaching or your kids are in school, we're not even close to our capacity. We've set up a system. If you need to get a test and you're part of a school community, please call 857-1814. We'll get you in right away. We'll get you tested right away. We'll have your results that day. As of this Monday, 2 days ago, including all school cases identified since the start of school through both the special K-12 testing system and the regular testing infrastructure, we found 33 positive cases among students and school staff who had been in school buildings. We found another 44 cases, positive cases, among students and school staff who have been learning virtually. So a total of 77 cases. The majority of the cases in the school community didn't happen in a school building. They were among people who never stepped foot in a school, who are instead learning virtually at home. So why is this important? First, although it's only been 1 week, and I realize it's only been 1 week, at this point, we are not seeing transmission within schools. We're monitoring it closely. We're going to be very vigilant. So far, hats off to the Department of Health team. They have tested, immediately done contact tracing, and isolated or quarantined everybody that needs to, which is why we have been able to prevent the secondary transmission and an outbreak. So I want to say thank you. But secondly, to highlight, we're going to see cases. 1 week, 77 cases. 15% of the entire state of Rhode Island is associated in some way with schools. Their students, their parents, their teachers, their coaches, their employees, their whatever. So throughout the spring and the summer, even when we had nobody in school, we saw cases among our school community or someone associated with the school community every single week, just as we did with every other demographic. Now we've got about 100,000 kids back in school in some way or another. We will continue to see cases for the kids in the school building and the kids virtually. The key is that we contain the cases. We contain the cases so we don't see new spikes, big outbreaks. And so far, after 1 week, it suggests that our systems are working. Our systems are working. The testing, the contact tracing, the isolation, symptom monitoring. I will say many of the cases result from folks who went to school sick. So please, if your children are even a little sick, if you're a teacher, you're a custodian, you're a reading coach, and you're even a little sick, I'm asking you, please don't go into school. Go ahead and get yourself tested first. But good news is we've been at it for a week. Systems are working as intended, no outbreaks. I want to take a second to talk about the protocol for the testing sites. I believe these testing sites are going to be vital to maintaining our safety in schools and to keep schools open. So, and they're working very well. And I just want to remind folks how it's supposed to work. Last week, we had an incident in Providence where more than a dozen teachers who claimed to be close contacts of positive cases carpooled in just a couple of cars, showed up at testing sites without appointments. Now, in this instance, and in every instance, we accommodate that. We're going to test you. We're not turning anyone away. We want to take care of everybody. So if you show up without an appointment, of course, we're going to bend over backwards to take care of you. Having said that, we would ask that you please follow the protocols. So, number one, if you're a close contact of a positive case, you're going to get a call from the Department of Health informing you that you were a close contact and you need to be in quarantine and get tested. So it's helpful if you don't just determine yourself to be a close contact. We did have some confusion around that in the first week. Confusion is normal. We fully expect that. But it's not helpful if you just get nervous, you think you're a close contact, you hop in your car and you drive to a testing site. It would be helpful if we could follow the steps to keep everybody safe. Second, if you're part of the school community, we would ask you please to just call 844-857-1814. You'll get a same-day test. It will be scheduled. You won't have to wait in line. You get your results that day. But if you can, please don't show up without an appointment. And then finally, be careful about carpooling. We want to keep all our teachers safe. So if you pile into a car without your masks on, that's not the best thing to do. So obviously, if you have to carpool, fine, but please wear your mask, keep the windows down, and limit the number of people in a car so we can keep everybody safe. Obviously, if you feel that you're a close contact, that's why you want to test. It's particularly irresponsible to pile into a carpool without a mask. So again, we're all getting used to the new systems, and I would ask you to just try to follow the rules so we can keep everybody safe. One more thing on the topic of schools. There's been a lot of questions about ventilation. We've all become quasi-air quality experts. And there's a big question around what schools can do to provide sufficient and adequate air circulation in classrooms. So I'd like to talk about it for a minute. This metric, airflow, was something that was evaluated during the school walkthroughs. But I want to thank the team at Art and Engineering, as well as Dr. Bromage and Jeremy McDonald and the other experts who we consulted during that process. Based on their expertise, as well as a recent report from Harvard School of Public Health, which I would encourage everybody to take a look at, we've put together a useful website with data on the effectiveness of all the different approaches to address airflow. And by the way, there are many approaches, or more than one approach, to address airflow. Opening the window, box fans and an open window, HEPA filters, other kind of filters. The experts from Harvard, from UMass, from other places, the experts say the key metric that we need to look at to keep folks safe as it relates to COVID is what they call air changes per hour. How much the air is circulating, how often the air is circulating in and out of a room. And they have, if you go to that website, they provide some useful techniques for how to best address COVID in indoor settings. The science indicates that given the size of a typical classroom, which I know varies, you want to see at least 5 air changes per hour or more. Sorry, you want to see 4 air changes per hour. They found that opening a single window, 6 inches or more, provides 5 air changes. If you add a box fan to that window, it increases the number of air changes to over 12 air changes per hour. In fact, that was one of the most effective approaches that they offer. I know we hear from some school committees, we don't have the money to provide a filter or air purifier in every room. Experts say you don't need to. I would encourage you to look at the science. I've heard some superintendents and school committees say, it just doesn't seem rational to me that an open window and a fan would do the trick. Well, the experts, scientists, say that it is, under the right set of circumstances. So I would encourage you to go and use this tool that we have on the website. There's a tool on the website which you can input the size of the classroom and calculate the effectiveness of a given approach in every situation. So for those of you who are interested in what the data and science says about the airflow, you can visit health.ri.gov/airflow, and you can learn more. I think it's even a fun thing to have the students do, to go use the tool, plug in the dimensions of the classroom, and figure out how many times the air changes in a given hour in that classroom. So the point of it is, we want you to be safe. You deserve to be safe. You need to be safe. There are different ways to guarantee the flow of air. Opening a window, fans, opening the doors, HEPA filters, air purifiers. There's a bunch of different ways. It's complicated. So I hope what we've tried to do is put this tool online, put the data and science there, inspect it yourself, and I hope it helps you to feel a little confident. By the way, teachers deserve to know. I've heard from a lot of teachers who want to teach. This is a way for you to test for yourselves and maybe have a little bit of peace of mind. They're doing the right thing in my classroom. And if they're not, then we have to make sure that they do. I will also say, anyone has any questions, call the Education Operations Center. I spent last Friday morning at our Education Operations Center. It's fantastic. It's the only one in America like it. It's a command center. It is a real live command center. And so if you have a question, if you're in a school and you have a question about anything related to your school's safety, call them. They're there to help you. They want to help you. They want you to call them. It's an impressive operation. I wish everybody could see it. They are there every day monitoring all the schools, all the districts. They're sending out support teams to schools to check it out with their own eyes, what's happening there. Everybody has lots of questions. We've never done this before. It would be a miracle if you weren't confused. It would be a miracle if you didn't have questions. So we set this up to help you, to give you a hand, for you to have support. So if you're not sure how to set up a fan, is the fan good enough? Are you doing the right cleaning protocols? Are you cleaning enough? Are the kids distanced enough? Is your way of symptom tracking safe? Call them, ask them for help. They'll walk you through it. If they can't do it on the phone, they'll come out and visit with you. But we are totally committed to getting the children to school and making sure people are safe. Let's let Rhode Island lead the country in this way. Let's give our kids the chance that they deserve to get a high quality education in person, and let's do it in a way that keeps everyone safe. I'd like to end on the school section just by thanking teachers. We're asking a lot of you. We always ask a lot of you. It's tough to be a school teacher. It's tough to be a school teacher that has to work in a 60-year-old building. It's tough on a good day. It's really tough right now. So thank you. We're asking a lot of you, and I hope you see we're doing a lot. I'll do whatever we can do to make it so that you are operating in a safe work environment. And just we want you to be at your best in school. I know your anxiety is high. I know you're fatigued. I think the more we do it, the more we get into the systems, actually the easier it will be. But for the moment, I want to say thank you for your extra work and for your patience and for your commitment to your kids. Finally, I'll end where I usually begin, with a quick report on what we saw at Rhode Island's businesses in the past week. Last week, out of approximately 1,000 businesses inspected, we saw some of the highest compliance rates we've ever seen. Employee and customer mask wearing was above 97%. Almost 93% of businesses had proper social distancing. And 99% of businesses were complying with capacity restrictions. At bars, 93% had customers properly separated from bartenders, and over 98% had no crowding in the bar area. That's so good. Thank you so much. 88% of businesses were conducting health screenings of staff and customers. That's the highest we've ever seen. It's still not good enough. There's actually no excuse to not do this, so we should be at 100%. Even if you just ask somebody when they walk in, how are you feeling? Do you have a fever? Or get a handheld thermometer. It's not that hard to do. It should be at 100, but thank you. 88% is the best it's ever been. We're headed in the right direction. I especially want to call out manufacturers. Please, please, we never shut you down during the crisis. Unlike most states, we need you to screen every single employee for their health every single day that they walk into the manufacturing operation. I want to give a big shout out to Rhode Island businesses, and I mean this very sincerely. Our businesses are amazing. I go into restaurants. You are modeling behavior of resilience and creativity and entrepreneurship and stick-to-itness, and I think you're incredible. I hope the Take It Outside effort helps you. I hope the Restore RI helps you. But because of you, Rhode Island is ranked #2 in the country for the second week in a row among states' economic recovery. We're at about 90% of our pre-COVID economy. Now, I understand that there's still a lot of pain out there. A lot of small businesses are barely getting by. The name of the game is survival, but you are doing a great job. You're #2 in America, and the fact that you have your doors open right now tells me that you will survive, and call us if we can help support you even more. Okay, with that, I'll turn it over to Dr. Alexander Scott.
Thank you, Governor. Good afternoon, everyone. As always, thank you for being with us. As you can see, we are rich with information for you today, so this is the place to tune in for that. As the governor said, we have 121 new cases to report with a percent positivity that's less than 2, given the high number of tests we are continuing to do. There are 86 people currently hospitalized with COVID-19 in Rhode Island. Of those people, 9 are in an intensive care unit and 5 are on a ventilator. Sadly, we have 3 new fatalities to report today. One of these people was in their 70s, one was in their 80s, and one was in their 90s. Our prayers continue to be with the families of these dear Rhode Islanders. As the governor said, K-12 schools has been a major focus for us over the last week and over the last several weeks and months. In addition to Dr. Bromage, Jeremy McDonald, Arden Engineering as the experts that the governor mentioned, we also want to acknowledge Dr. Michael Burns, our environmental health toxicologist at the Rhode Island Department of Health, for his fantastic work as well on the air circulation guidance that the governor described and we have available for you to check out on the website. Dr. Burns is one of the many people across our entire state government response who is doing yeoman's work to support our public health response and keeping it strong. To share a little bit more about the K-12 data that was relayed, of the 33 cases we have seen in the in-person learning community, 19 of them have been students, and the rest were among teachers and staff. Of the 44 cases we've seen in the virtual learning community, 40 have been among students, and the remaining 4 were among teachers and staff. As noted, we have done thorough, aggressive, rapid case investigations and contact tracing around each of these cases. The 33 cases that we have seen in the in-person learning community have occurred spread out among 25 schools. In the schools where we have seen multiple cases, which is fewer, we have usually been able to identify a likely common exposure outside of school. So let me give an example. There have been a few instances of siblings in the same school being sick, and of friends who reported closely socializing outside of school also having symptoms. In each of these cases, the centralized, dedicated K-12 testing program that the governor spoke about has been critical. It's allowed us to act quickly and aggressively. And as we've mentioned, the key is stopping secondary and tertiary transmission. When you have cases that are isolated, a case here, maybe one or two, spread out across the number of schools that we're talking about, that is the ideal instead of having clusters of cases associated with the school. When they're isolated and spread out, that means that we are stopping transmission from occurring again and again. And that is a key approach to our system. One of our strengths in Rhode Island is our testing capacity. Again, if you work in a school and you have symptoms or you were exposed to someone who has symptoms, that is the reason to go ahead and get a test. We've shared the number, 844-857-1814, and it's important to know that the Rhode Island Department of Health will work very closely with you. You will hear from the department. They will direct you to engage with the test scheduling program and to go ahead and get tested so that we can respond quickly. Our testing system is unique. It's fast, it's easy. The wait times on the line are under 2 minutes, and people are able to get tested the way we need to so that we can stop further transmission. One thing I want to clarify is that when people who have symptoms get a rapid test, the result is not available right then and there on the site as the rapid test. We are encouraging people who get tested through the system to get tested as early as they can during the day. All tests up until 3 p.m. during that day will be resulted the same day. Regardless, someone who has symptoms or who has been exposed to someone who has symptoms and gets tested should be staying home and isolating or quarantining and not going anywhere until they receive the test results. Another key to be aware of is those who have a negative test result need to wait until the PCR test that has a 1 to 2 day turnaround is resulted as well, particularly if their rapid test is negative. These are messages that we will continue to make sure that the entire school community has and understands. If you are positive, you will be called by the Rhode Island Department of Health. If you are negative, we will send you a secure email with your results. Email addresses have to get entered into the system, email by email. So if there is an issue, you may get a call from us with your result, even if you are negative, because we want to ensure that the results are made available to you quickly. But generally, people who are negative can expect to be notified via email with that result. And of course, as we have set this up, you can always call us to get your result as well. The number to call for the result is the same number that you call to schedule a test, 844-857-1814. Through all of this K-12 testing, we are committed to ensure that the public has an accurate picture of how COVID-19 is affecting the K-12 community, the school community as a whole, across the state. To back that up, we have posted a data dashboard online so that people can see case counts for individual schools in ranges the same way that we have posted nursing home data over time. We have 2 tables posted, one for students and staff in schools that are doing in-person learning, and one for students and staff in schools that are doing virtual learning. We will post data for the previous week every Wednesday. So we're announcing that today's data for the previous week is available and will continue to keep that A+ grade that the governor mentioned we have been given as a state regarding our data integrity, and analytics. In addition to our work with K through 12 schools, we are working very closely with the colleges and universities throughout the state. We've been working with Providence College nonstop since we first identified a situation there early last week, as the governor has described. Given that someone can start to develop symptoms up to 14 days after their exposure to someone who is sick, we still have to remain extremely vigilant about this situation. However, I did want to speak to people in the community, people throughout Providence, and people throughout the state, so that you can hear, in addition to what the governor said, that we are doing everything in our power to limit or prevent the spread of COVID-19 in the areas that have been impacted. We have a whole team that's 100% dedicated to this issue. Before opening things up for questions, I'll just say a word or two about our case investigations, the way I want to do each week, so that you have a real-time update of what we are continuing to see. Between September 8th and September 14th, 53,840 tests were completed and 599 new cases were identified. Social gatherings continue to be an issue, and as we have said, it's not as much or not only the size of the gathering, but it's also keeping your groups stable. When you go to different groups of people, that is how the issue can occur, as you've already heard today. So during this time last week, from September 8th to September 14th, 24 people in the 20 to 29-year-old age bracket reported attending a social gathering in the recent past. The previous week, that number was just 3 people. We've discussed colleges already, and that's critical. I know college students are hearing that and recognize how their actions can contribute to these numbers. But it's helpful to know that beyond the Providence College and URI situation, these are not just college students that we want to raise this awareness about. All of us need to be vigilant about keeping our groups consistent and small, and wearing your masks. Those are our key components that we know work. And what has happened with the data is evidence that it makes a difference. Something else that we're continuing to see in our case investigations is that certain industries are more affected. During this last week period, we saw 26 cases among people who work in manufacturing and 25 cases among people in retail. As a reminder, anyone who works in a high contact industry can get tested, even if you don't have symptoms. To schedule a test, particularly if you don't have symptoms, you can go to portal.ri.gov. If you have symptoms, you still can, but also can engage with your primary care doctor or nearby urgent care center or respiratory clinic. As stated earlier, testing is one of the most powerful tools we have right now, and Rhode Island is among the best in the country in doing that. So please take advantage of the testing opportunities that we're making available. With that, we will open it up to questions.
Doctor, what does your modeling tell you insofar as the projections for illnesses or deaths between now and the end of the year? And is the state's hospitals capable of handling any increase?
Similar to what we saw in the dashboard that was relayed today, the numbers for hospitalizations is well below the cutoff for concern. We're working closely with the hospitals and feel that they have the capacity. So from our projections standpoint, we're staying vigilant, but are confident that our hospitals have what they need to respond going forward.
I'm sorry.
Our projections overall, prior to the cases that the governor discussed that we've seen from our colleges and universities, had continued to remain in a plateau and a strong low level. So our focus right now is getting our handle on what we're seeing with colleges and universities, working with the administrations to be as responsive as they are and as aggressive as they can be in getting those cases contained, testing, and getting those numbers down so that we can return to the types of projections that we had previously.
If I may follow up, short of an inoculation, you don't see, or vaccine, you don't see a significant decline in the rate of illnesses or deaths.
Our goal is to see a significant decline and to do all of the steps that we need to, like masking and distancing. Time will tell. We'll continue to follow the data.
What factors are there beyond
the level of testing that and the college outbreaks that contribute to Rhode Island having the high per capita new cases?
What was described are the primary factors, seeing the increases in cases, that bump, and the difference in those cases adds more to where we were at the baseline last week. So that is the primary contributor at this time.
Are there others?
The usual components that go into where we were previously, the isolated cases occurring throughout the communities, all of which reinforces the importance of everyone continuing to mask, everyone continuing to watch their distance and stay vigilant.
Governor, give
question, Doctor.
Yeah. The question was, are there other factors for Rhode Island that had us somewhat above our neighbors in the per capita cases beyond the level of testing and the college outbreaks?
Thank you for repeating that. So the colleges, what we're seeing there are the key. We are testing the most. We have a densely populated state, and we are testing more in our densely populated communities, which were the same factors that were contributing previously. So there isn't any additional difference beyond what's been shared with the colleges and universities.
But you have almost 200 cases associated with 2 colleges. That's the answer.
Governor, given what you said that college kids will be college kids when returning to campus, should something have been done proactively ahead of kids coming back? And I know a lot of this is off-campus housing, Greek houses at URI. So was there mistakes made there? And can anything be done moving forward to act preemptively other than school suspensions or discipline when it comes to these kids?
Yeah, so it's a great question. I would say this, you know, hindsight is 20/20, and I'm sure the administrators at PC are asking themselves that exact question: what should have we done? I think we knew, like, look, problems of partying on Eaton Street are not a new thing. We saw this at PC in the spring when this happened. So I would have liked it if the college had done more proactively. We knew this was going to be a problem. Having said that, we are where we are now. They are cooperating with the Department of Health. I think they've gotten religion on the topic, and we're going to work with them. But what I would say this, and I've said this to every college president: you must hold the students accountable for their off-campus behavior. There has to be real on-campus consequences for what the students do, even when they're off campus. And we've been crystal clear about that. You know, we thought about not allowing the college students to come back to campus. We thought about requiring them all to do what Brown did, which was, you know, start in October. And we chose not to do that, largely because we had these discussions with the college presidents and their teams, and we said to them, are you going to be able to control the behavior of your students off campus, in bars, in off-campus housing? And they all said they could, and they all said that they would take precautions to make that happen. By the way, they all did, but obviously it wasn't enough. So we're learning, and we have to continue to do more.
Just to follow up, and I know you said obviously there's consequences beyond the schools with the travel restrictions and affecting all Rhode Islanders, but maybe Dr. Alexander Scott has some information. Are any of these kids, whether it's the college students or grade school kids, been hospitalized? Are there any significant, I guess people might say, how sick are these kids?
There are no associated hospitalizations at this time with our institutes of higher ed cases that we know of.
K to 12?
K to 12 as well.
Governor, in regards to Providence College, do you agree with the Providence lawmakers who are calling on DC to go full remote learning for the remaining of the year?
I'm not there yet. This is an unfortunate situation, and the college didn't have the systems in place adequately ahead of time to prevent it. So they're doing a good job now, PC is, and they're enforcing the stay-at-home order. I think this is preventable going forward. I mean, there's not that many homes on Eaton Street. They've hopefully learned their lesson. The school has to do better monitoring, better enforcement. So I think no. Anyway, my short answer is not at this time. If this continues, absolutely.
Question in regards to K through 12, we're getting some concerns from parents with buses and windows having to be open as we get into the colder months. They say that it's not healthy. Do you plan on updating that guidance as we get into the colder months?
We'll deal, like everything, we'll deal with it when we get there. But I think they'll probably have to keep the windows open though.
Yeah, Governor, that was my question. I heard from a father of kids in Exeter. They're on the bus for 45 minutes. Now, you know how cold it was Saturday, Monday, Tuesday. And he said, I mean, it just throws them off for the entire day, just getting there. You know, you're in a park in September. And so I appreciate the push for fresh air. But, you know, you're creating the playbook on this. At what point do you decide to rewrite it a little bit? At what point do you have enough body of evidence to say common sense would dictate that maybe we don't need to have every window open for 45 minutes in December?
Exactly. So you just answered your own question. So I would encourage you guys, members of the press, to go to this new website, the new tool, the health.ri.gov/airflow. You could do the math and you can actually figure out how many windows have to be open in order to have enough air circulation in a bus. I cannot tell you as I stand here how many that is. But again, I would just say this. We're living in a highly imperfect world. I understand the kids will get cold, potentially. It's better than not going to school and better than getting COVID. And I am hopeful that by the winter, we might have a vaccine or better therapies. So I'm not going to today make any proclamations about what we're going to do in December. But I think the short answer is what you said. Not every window has to be open the whole time.
Right. And, you know, I didn't major in math either, but his question was, has anybody from the Department of Education or the Department of Health ridden on a bus? Has any one of your staff actually gone, not just this last couple of days, but are you going to go on the bus and sit there and see what it's like for the kids? Commissioner, you talk about all the time about getting our kids ready and everything else. Has anybody from Rye ridden a bus with all the windows open?
We have been on the bus. So we have staff that has done that, and we will continue to do that. But it's as the temperature changes. And the other thing that we have done is that we're in contact with other states that have had very low incidence that have different procedures and protocols than we have. I think I talked about it before. We've been in contact with Indiana, who has had very small cases, and they have different bus procedures. So we're also learning from other states that have gone before us on what their busing is. So we're looking into it. So this is not something that we're not taking into account.
Just one follow-up, Dr. Alexander Scott. There was a big hoo-ha last week about silent lunches and kids not being able to talk. And somebody had looked at a professor from out of state. What does the health department have to say about that? Because a lot of elementary schools have adopted this now. The kids, if they're sitting there, and you can imagine, you've had your own kids that, I mean, telling them to be silent either on the bus or at school, it's just, it seems untenable and it seems a little draconian.
What we have said is put together the measures that work to increase compliance for children to wear masks during the day. It's a lot to be able to wear masks throughout the course of the entire day for students. And so there are a variety of approaches that schools can take to help increase that compliance by allowing for structured times when they can take their mask off, whether it's a certain time during the day, during lunch, going outside, as long as people are appropriately distanced. We've also shared that if those breaks are built in the ways that the school determines, the risks for COVID transmission are decreased if there is less talking during that time.
Right, but adults who go to a restaurant, you don't expect them to sit and either not talk to each other or not take off their masks to eat. So why, at a restaurant, why wouldn't that apply to kids who, as we know, are not as likely to get or transmit COVID? It doesn't seem to make any sense.
There are a variety of approaches schools can take. If that is one of them, and that's a way to increase compliance, that's something we have considered acceptable, as long as they are allowing for other ways for the students to be able to engage. We know how important it is to be together in person, and there are other approaches that can be taken as well.
Governor, last Wednesday, you announced that there'd be $1 million available for businesses to be outside. What was the reaction to that? Can you give us an update?
The reaction's been very positive. A lot of small businesses, especially restaurants, have reached out and said, great idea, because I need heat lamps, and they're expensive and hard to find. So I'm sorry, I'd have to get you the details of exactly where that is in terms of have they started with the applications. But I know there's a lot of interest. Like yeah, absolutely. There's a lot of interest.
More than 80?
Okay.
More than 80. Is it at the 1 million, or is there still money? Is there, if it's been that positive?
I'm very open to doing more. If it's a success,
Yep.
and if it helps businesses stay open longer, I'll figure out a way to expand it.
To get more money into that.
Yeah,
And just,
yeah.
I want to clarify, with all the outbreaks of the colleges, that said, plus K through 12, but none of those students are in intensive care on
Correct.
respirators. So knowing that, and it seems different than what we thought of the virus back in the spring when all the schools shut down. With that being that way, is there any reason why students shouldn't be back in Rhode Island for in-person learning?
I don't think so, and I maintain that position. I just last night, the Warwick School Committee, for a minute, they were going to do the right thing and let the kids go back to school, and then they chose not to last night. Pawtucket, I don't see any reason why they're not back in school. So we're going to keep pushing them. And that's why I set up this command center. It's a command center because I know they're worried. They don't know how to do it. I understand that. So call us. Let us help you. It's possible. The children deserve it, and the kids are going to suffer more. Like, to your point about risk, I understand there's a risk that people will get sick. There's a guarantee that they're going to fall behind, suffer mental illness, be out of sorts if they don't go to school.
And especially the special needs kids who,
It's
I mean,
terrible.
that's impossible for them
It's
to learn.
very tough. Multi-language learners, poor kids. This he's been waiting for a while.
For the doctor, I'm sorry?
Last two mic.
Thank you. Doctor, looking at the group of people under 30 who have been diagnosed positive, tested, and that would include the colleges and the K-12 system. Is there any increased risk of transmission because a larger number than otherwise in other age cohorts are asymptomatic or very mildly symptomatic to the point where they don't know they're infected? And if so, has the Department of Health tried to measure the extent of that? You know, what percentage of people continue to socialize, even in limited ways, not knowing that they're infected and capable of transmitting the virus to others? Because, I mean, CDC doesn't really know how many people are asymptomatic. The latest guidance from them could be as low as 10%, it could be as high as 70%, so they pick the number and they figure it's about 40%. Has DOH measured that? And when people have tested positive, do you know whether they've been symptomatic or not?
Absolutely. We do. We track very closely what proportion of our cases are asymptomatic versus our cases that have symptoms. Still with our institutes of higher ed, more of the cases did not have symptoms compared to those who do. It's further evidence for why we have to be vigilant about messaging, regardless of how you feel. You need to wear your mask. You need to keep your distance. You need to keep your groups small, and you need to keep them stable, particularly among people who otherwise feel healthy and feel fine.
What is the percentage of people who've tested positive in that under 30 cadre who are asymptomatic or mildly symptomatic to the point where they don't know that they're infected?
I'll get back to you with the exact number.
And also, the governor talked about the red lines on the chart. If we start to approach those red lines on any one of those three graphs, what types of public health measures would be necessary, other than very coarse things like rolling back the prior phase, that you feel would be indicated to try to combat that increase?
That's something that we are always in discussion on. It would be driven by the types of cases that we are seeing to help inform which interventions would give us the highest yield, the most targeted intervention, which is always what our approach is. Examples of that include how we are assessing people in the work setting who are going to work sick. If those numbers were to increase or to continue, what are additional changes that we would need to do in a work setting to help address that? Similar to what we're doing with Providence College, there's a stay-at-home directive specific to Providence College. We're repeating the second round of full student body, the whole student population being tested this week, and continuing to take the aggressive steps we need to bring it under control. The governor has always mentioned being pinpointed and targeted. Our comprehensive testing and case investigation and contact tracing system allows us to continue that going forward.
Tanya Signori from the Rhode Island Echo to the governor. Regarding hospitals and regarding nursing homes, are we still, I'm not sure why there's still not a separate wing going on in hospitals and in nursing homes. There's still some that don't have a separate wing. And the governor can answer as well. I just didn't think there'd be mixing of patients, mixing of COVID patients with regular patients, whether it be 2 doors down, 1 door down. I understand there's different pressure system.